I think a lot of the times it depends on what kind of a doctor you are, right? So surgeons a little bit different because again, it depends on caseload. It depends on sort of how much interaction they actually have with the patient, when they're in an awake state. For family providers, it is so important because we're the ones that are the first point of contact with that patient. So we're the ones that they need to be trusting, right? So if you have a very strong relationship, then that sort of sets the tone with how they look at healthcare, how they look at their specialists. If they don't have a good relationship with their family doctor, they're probably not going to think that highly of medicine in general, because that is the doctor that they spend most of their time with. And so I think the most important quality for a family doctor is to have compassion. A lot of the times, like when I'm at a walk-in clinic and things are really busy and I can't give patients the time, that I ideally would love to give them just because the clinic is really busy and I'm the only provider there. Sometimes you have patients coming in saying, the doctors don't listen, the doctors don't care, it's like they just want to get me out the door. And that is not a good feeling. That is not the goal, right? That we don't want patients leaving a doctor's office thinking that. We want them to think that we do care. We want to make sure that they're doing better. Sometimes, unfortunately, scheduling can kind of take a hold of the situation, and as a result, the compassion or the patient interaction suffers as a result. I personally was in a very severe accident back in 2014, and so I was a patient. I was in a hospital. I was there for 6 weeks, and I wasn't able to go home, and I would have people coming and doing rounds on me. So I've been on the other end, and I have definitely disliked certain things and I've loved other things. And so what I did is, through my journey, I've sort of picked up on the things that I love doing. And sometimes when I'm overworked and I'm getting burnt out, which I'm sure you can see on my Instagram sometimes with how much I'm working, I just have to kind of revert back to that experience and just think, you know what, it made you feel really bad when that happened. So just make sure that you don't end up projecting that onto your patients, even if you're having a bad day. And so I always try to be mindful of that as much as possible, especially on busy days.